Welcome to this introductory presentation of individualized supports for students who are deafblind. This initiative was developed through a collaboration between the New Jersey Department of Education and the College of New Jersey. There are 5 training modules in this series. Module 1, What You Need to Know About Hearing Impairment, will begin now. Hearing is a distant sense. Hearing loss affects how close a sound has to be before it is actually heard. Any background noise will interfere. The size of the listening bubble around the person who is listening depends on the degree of hearing loss, the voice quality of the speaker, and other noises that surround the person in the listening bubble. And here's a photo of here's an image of the listening bubble. On the left, the little boy is inside his listening bubble, and the girl, who is the speaker, is outside the range. On the right-hand side, she moves closer, particularly closer to the little boy, and now she is in range, and the little boy is able to listen. Out of earshot means language is not caught, so it is always important to be inside the listening bubble. Hearing does not really develop once a child is born. Children can actually start hearing in the womb at about 4 months gestation. When born, children hear as well or even better than adults. But the difference between a baby and an adult is that the baby needs to learn what the sounds mean. When born, children with hearing loss are already behind in 2 important aspects of hearing: sound awareness and sound identification. A child with normal hearing will develop auditory skills needed to detect, identify, and comprehend what sounds in their environment mean. And this all starts to occur during the first few months of life. Children with hearing loss who can access the auditory world must be exposed to a specific hierarchy of experiences so that they can learn skills of sound awareness and identification. And this is true even for children with mild hearing loss. Hearing loss affects how loudly sound is perceived, as well as the perception of different pitches of sound. When we talk about the loudness of sound, we're referring to volume, decibels. When we refer to the pitches of sound, we're talking about frequencies, the hertz. Many children with high-frequency hearing losses are missing those high-pitched sounds and may only be able to perceive the low-pitched sounds. Many consonant sounds in speech are high frequency, and vowel sounds are primarily low frequency. Let's define hearing impairment. Hearing impairment is a generic term referring to a condition of reduced hearing ranging from mild hearing loss to profound hearing loss. There are 2 subsets of hearing impairment. Deafness is the first subset. Deafness refers to a degree of hearing impairment that precludes the successful processing of linguistic information through the auditory modality, with or without a hearing aid or other listening device. Hard of hearing is the second subset. Individuals who are hard of hearing have residual hearing sufficient for successful processing of linguistic information through the auditory modality, generally with the use of a hearing aid or other listening device. An audiogram is generated after a person receives a hearing test. The horizontal axis on the audiogram measures frequency or pitch, and the unit of measure is known as hertz. The vertical axis measures intensity or loudness of sound, also measured by decibels. On most audiograms, the right ear is denoted by a 0 or an O, and the left ear is denoted with an X. To draw meaning of hearing loss, and where in terms of where it falls with speech sounds and other environmental sounds, it's important to look at where speech sounds fall on the audiogram. The speech banana, as you can see, the yellow figure that's banana shaped in the middle of the audiogram, is where all of the speech sounds are contained. A person with a mild to moderate or more severe hearing loss is missing some or all of the speech sounds that fall within the speech banana. This photo also denotes some environmental sounds: a dog barking, a lawnmower, a telephone, an airplane, or even softer sounds like the leaves and the wind and a fan. These all depend on the person's hearing loss in terms of the frequencies that they can perceive and the loudness that they're able to perceive. The types of hearing losses: there are 3 major types. A conductive hearing loss impacts primarily the loudness, the decibels of sound, and the sensory neural hearing loss impacts the frequency or the hertz. The third type of hearing loss is a mixed loss, a little bit of conductive, a little bit of sensory neural. A person can have a combination of these and be considered to have a mixed loss. There are also types of hearing loss that refer mostly to the processing of auditory information by the brain. Auditory neuropathy and central auditory processing disorder, also known as CAP disorder, are these 2 types. There are some critical factors that influence the overall effects of hearing impairment. The age of onset: was a child born with the hearing loss, or did they acquire it later? Is a very critical factor. The degree and type: it's important to know, is this a loudness issue or a frequency issue or both? The stability of the hearing loss: it's very important to know if the hearing loss will change over time. And when we say change, we mean usually get worse and not better. And knowing this bit of information allows us to plan appropriate education. And of course, the last critical factor that influences the overall effect of the hearing impairment is the actual educational intervention. Did the child receive a mode appropriate means of instruction and access to language based on their access to auditory information or not? Language of children who are deaf and children who are deaf-blind is different, not necessarily delayed, but they are at risk for experiencing language delay if they don't have access to language experiences early in life and throughout childhood, experiences that are mode appropriate based on the type and degree of hearing loss that they have. Children with hearing impairment challenge our thinking in a variety of ways. There is the way we think about hearing versus perceiving. Is the child perceiving enough to really learn language incidentally? In hearing children, And in children who are sign language communicators who have deaf parents, they're not specifically taught the language. They catch the language in the environment. In this picture, how much is the boy going to get in terms of language input if he has a hearing loss and the speaker is always talking outside his range, outside his listening bubble? Language perception relies on many language repetitions. Typical children receive thousands of exposures to language within the first year of life before they ever even speak their first words. So hearing impairment, it can be a barrier to information gathering. We hear with our brains. The neural pathways must develop within the first few months of life through exposure, through these thousands of exposures to language. Children tune into speech for a full year before they ever speak their first words. Hearing loss is a barrier to children being exposed to language and will delay their readiness to begin talking, because the message getting in is incomplete and of insufficient numbers of repetitions. And their neural pathways will not develop optimally unless consistently stimulated before 6 months of age. So some goals for children with hearing loss. Well, screening at the birthing hospital. 25% of children with hearing loss by the age of 3 years pass this screening. So it's important to observe the child's behavior, observe their language behavior, and if there is concern, have them retested, because some hearing losses can be acquired in early childhood after they passed the infant hearing screening. Another goal is to diagnose and fit hearing aids by age 3 months for those children who do not pass the infant hearing screening at the time of birth. Another goal, to provide early intervention to families as soon as possible. 6 months of age, but it's almost too late. You need to do it as early as possible, because remember, it's all about repetitions and access to language to prevent language delay. Allow parents of the child to explore different ways to communicate with their children. Teach parents to communicate effectively. Assess how well the child is learning language and change the communication method as needed for the child to learn at a rate of normal or typical hearing babies. Some red flag questions regarding hearing. Does the child often fail to respond to typical sounds in his or her environment, such as dogs barking, doorbells, items dropped behind them, their names being called, the telephone ringing, etc., etc.? Does the child often fail to respond to his or her name or a noise that you would expect him or her to hear, such as a pot or a pan in the kitchen dropping to the floor? Does the child seem to respond less to sound now than when he or she was younger, an indication of an acquired hearing loss? Does the child seem to turn more to one side than to the other when sound occurs? If we have hearing in both ears, we should be able to do what we refer to as auditory localization, turn in the direction of the sound. A child with a hearing loss in one ear may not be able to localize to sound. Does the child often seem to watch your lips while you're speaking? So it's all about access to the linguistic world. How do we make sure that a child with deaf blindness is accessing what's going on? What do we have to do? How do we make sure the child with deaf blindness has all the tools necessary to develop literacy? Literacy is an extension of language, and in order to develop literacy, access and use of language and in a proficient manner is absolutely necessary. Sign language is, first of all, the natural language of the deaf. Harlan Lane in 1997 said that sign language is the mode appropriate language for persons who are deaf who do not access the auditory world. But sign language can also be important for persons who are hard of hearing in order to improve clarity and understanding as a backup system. Deaf students who do not get exposure to sign language acquire and use a variety of gestures and what we call made-up signs. Some people refer to these as home signs. They tend to make up their own home signs, and they also tend to pick up their parents' gestures. The development of sign language follows a sequential path that is very similar to that of spoken language. In terms of quality of development, this is dependent upon the child's early exposure to sign language in the same manner that hearing children have early exposure to spoken language. The development of sign language also strengthens the development of English skills for those who are exposed to sign language early in life. This has been well documented in deaf children of deaf parents who in later life, when they pursue literacy skills, they become better readers, they become better bilingual communicators in terms because they had a strong linguistic foundation from their deaf parents in sign language, and they were able to better build English skills on top of that. Hearing is a distant sense. I think the next portion of this is a 5-question post test. Please